Introduction. Welcome, medical students, to today's lecture on the fascinating topic of vitamin D metabolism. In this comprehensive script, we will delve into the intricate details of various aspects surrounding vitamin D, from its synthesis and activation to its role in different organs, regulation mechanisms, and therapeutic uses. We will also explore the effects of deficiency, toxicity, and its impact on the immune system. So, let's begin this journey by understanding the basics of vitamin D metabolism. Vitamin D metabolism involves several crucial steps that are vital for maintaining optimal levels of this essential nutrient in the body. When sunlight hits the skin, a precursor molecule called 7-dehydrocholesterol undergoes a photochemical reaction, leading to the formation of cholecalciferol or vitamin D3. This inactive form of vitamin D then enters circulation and undergoes various conversions before becoming biologically active. Once cholecalciferol is synthesized in the skin, it undergoes two hydroxylation steps to become activated. The first occurs in the liver, where cholecalciferol is converted into 25-hydroxycholecalciferol or calcidiol. This intermediate form circulates in the bloodstream, serving as a marker for vitamin D status. The second hydroxylation occurs primarily in the kidneys, where calcidiol is converted into the active hormone, 1,25-dihydroxycholecalciferol or calcitriol. The liver plays a crucial role in vitamin D metabolism by converting cholecalciferol into calcidiol. This hydroxylation step is primarily catalyzed by the enzyme 25-hydroxylase. The liver also contributes to the regulation of vitamin D homeostasis by producing vitamin D binding proteins, VDBPs. These proteins facilitate the transport of vitamin D and its metabolites in the bloodstream, ensuring their efficient delivery to target tissues. After the initial hydroxylation step in the liver, calcidiol travels to the kidneys, where the final activation occurs. The enzyme 1-alpha-hydroxylase present in the proximal renal tubules converts calcidiol into calcitriol. Calcitriol acts as the biologically active form of vitamin D, exerting regulatory effects on calcium and phosphate homeostasis. The synthesis and activation of vitamin D are tightly regulated processes, influenced by several factors. Parathyroid hormone, PTH, and fibroblast growth factor 23, FGF23, play integral roles in maintaining calcium and phosphate levels, which, in turn, regulate vitamin D metabolism. Additionally, feedback mechanisms involving calcitriol and its receptors contribute to the fine-tuning of vitamin D synthesis and activation. Vitamin D binding proteins, synthesized in the liver, aid in the transport of vitamin D and its metabolites in the bloodstream. These proteins ensure the efficient delivery of vitamin D to target tissues, protecting it from rapid degradation. Furthermore, VDBPs also modulate the release of calcitriol from storage, making it available as needed to maintain calcium and phosphate homeostasis. While the kidneys are the primary site of calcitriol synthesis, other tissues, such as immune cells, also possess the enzymatic machinery required for its production. This extrarenal synthesis of calcitriol has been found to play a crucial role in the regulation of immune function and in inflammatory processes. Calcitriol exerts its biological actions on target tissues by regulating calcium and phosphate levels. It enhances calcium absorption in the intestines, reduces calcium excretion in the kidneys, and stimulates osteoclast activity to release stored calcium from bones. Additionally, calcitriol promotes phosphate absorption in the gut and inhibits its reabsorption in the kidneys, thus influencing phosphate homeostasis. Inadequate exposure to sunlight, insufficient dietary intake, certain medical conditions, and impaired metabolism can lead to vitamin D deficiency and insufficiency. These conditions have been associated with various health problems, including bone disorders, cardiovascular diseases, autoimmune disorders, and an increased risk of infections. Vitamin D analogs, structurally similar compounds to the active form of vitamin D, have been developed for therapeutic purposes. These analogs offer benefits in treating conditions such as chronic kidney disease, psoriasis, and certain cancers. Their modified structure allows for targeted effects while minimizing unwanted side effects. Although vitamin D is essential for health, excessive intake can lead to toxicity. This condition, known as hypervitaminosis D, is characterized by elevated blood calcium levels, leading to symptoms such as nausea, vomiting, muscle weakness, and even kidney damage. It is crucial to maintain a balance and adhere to recommended dosages to avoid vitamin D toxicity. Emerging research has highlighted the crucial role of vitamin D in modulating immune responses. It has immunomodulatory effects, impacting both the innate and adaptive immune systems. Vitamin D deficiency has been associated with increased susceptibility to infections, autoimmune diseases, and allergic reactions. Understanding this connection can help in designing potential therapeutic strategies. In conclusion, Vitamin D metabolism is a complex and intricate process that involves several organs, enzymes, and regulatory mechanisms. From its synthesis in the skin to its activation in the kidneys, vitamin D plays a vital role in maintaining calcium and phosphate homeostasis, as well as regulating immune function. Adequate vitamin D levels are essential for overall health, and understanding its metabolism and various aspects can aid in the prevention and management of related disorders.